On this episode of Putting Possibility into Practice, we are harnessing chronic care management to help grow your practice. We discuss the ins and outs of chronic care management to help create successful outcomes, and how can you get compensated for your efforts. This is Putting Possibility into Practice, and it starts right now. I'm Joe Agustinelli, Social Media Manager at Greenway Health, and welcome to this episode of Putting Possibility into Practice. If you're a first-time listener of the podcast, we're glad you found us on your platform of choice, and if you're a returning listener, we hope that you will continue to listen and subscribe to our podcast if you have not already on your favorite podcast platform of choice. And on this episode, we're talking about caring for patients with multiple chronic conditions who need additional care planning and attention, which requires agility, and the Centers for Medicare and Medicaid Services will compensate you for your efforts. Now, to discuss the ways that you can grow your practice with chronic care management, I welcome my guest for this episode. He is Chris Gibson, and Chris is the Product Analyst of Population Health here at Greenway Health. Chris, welcome to the podcast again.
Yes, it's good to be back.
It's been a while. I think it's been like a year. We were in Chicago, I think, the last time we did a podcast episode, and back then we talked a little bit about an introduction to population health, so it's always good to have you back.
Yeah, we were in the side room, like finding some space.
Exactly. Yeah, we were in Chicago, 38-degree weather. Now it's Tampa, 82-degree weather. We're in the office, so always good to catch up with you. And first of all, as we talk about chronic care management, how does that differ from care that you or I or our listeners may be used to from their primary care provider?
Yeah, so there's a lot of definitions out there for chronic care management. I think there's over 42 or 43 definitions as out there from the different healthcare entities, official governing bodies out there. And when we define chronic care management, one of the ways that we can define it is that it really encompasses the oversight and education activities that are conducted by healthcare professionals, really to just help patients with chronic conditions, and chronic conditions being the key. And where that differs from your everyday patient, at least someone like myself, is healthcare. We're definitely trying to move to proactive care. For everybody. We talk about population health. That includes the infant all the way to the elderly. But right now, the big focus is on a specific population of patients, those that need to have their chronic conditions managed, CCM, and they already have the 2 or more chronic conditions, right? So we're managing these specific populations. So it's not everybody, at least for this program.
And obviously, these are patients who are going to be more. I know I go to the doctor, once a year for a physical, and then if something comes up during the year. But obviously, these are patients who are going to be seeing their providers far more frequently. Correct? Correct.
These patients, the minimum goal for a patient that is enrolled in the chronic care management service is to ideally get 20 minutes of non-face-to-face time with them per month. But that's the minimum, mm-hmm. right? Typically and ideally, there's more time being spent with that patient, so definitely more.
And discuss some of the key points when we talk about chronic care management.
Yeah. So chronic care management and the activities, we talked about some of those oversight and education activities. Some of those that we highlight are just assessing the patient's health, their mental and their psychosocial needs, ensuring that all the patients enrolled in the program are receiving and being prompted to get their preventive services done and taken care of systematically and on a timely basis. And then another big one, especially with the chronic conditions, are medication reconciliation and overseeing a patient's self-management of medication. So to make sure they're not lapsing on those. And, that's just a handful, but when you talk about the different activities from a base standpoint, really it's just carrying out the physician's plan and assessment. And a lot of people like to overcomplicate it, but if we're just carrying out, we're just an extension of what the physician is prescribing from a basic plan and assessment perspective, then you are performing proper care management on those patients.
And I had alluded to it in the introduction, but the Centers for Medicare and Medicaid Services, or CMS as they're referred to, will actually compensate providers for chronic care management. How does that work, and how much can a provider receive?
Yep. So in 2015, CMS approved the CCM code of 99490, which reimburses on average $42 per patient per month. In 2017, CMS added some additional CCM CPT codes, the 99487 code for at least 60 minutes, which reimburses $47 per month, and 99489, which is every additional 30 minutes on top of that 60 minutes for $94 per patient per month. And those are for complex CCM services. And then recently in 2018, CMS clarified how FQHCs and RHCs could be reimbursed for CCM services, and that was a baseline of around $62 per patient per month. And so that's kind of the reimbursement levels of your most basic CCM reimbursable opportunities out there, and depending on the entity type that you are and the level of service you're providing, the different levels vary. But really, it's considered a fee-for-service charge, so you're going to be submitting on a claim and looking to get reimbursed on that at the end of every month that you perform the service, just like any of your other procedures or tests you might do.
And as we get into now the rest of 2019, boy, it's interesting to hear you talk about 2015 and 2017, and it's like, gosh, they really were. It was 4 years ago and already 2 years ago. Unbelievable. Are there any new regulatory changes, this year that are affecting the program or impacting the program?
There are. So it's exciting to see that they're continuing their rollout of additional opportunities for practices that are caring for their patients proactively through the CCM program. One of the big new things that we want to highlight that is available this year is they're rolling out yet another code, the 99491 code. And what this is greater than 30 minutes per patient per month of CCM services provided by a physician or other qualified healthcare professional. And where this differs is this is essentially the physician, his or herself, or an equivalent, actually being the one to provide the CCM services. So in today's day, and it is and has been most efficient to scale out a program leveraging one's clinical staff to reach as many patients, which still is going to be the case. But where this goes after is where we see this getting implemented is really in a smaller scale. But we expect providers are really most likely going to use this code to manage their higher risk patients, ones that they may want to have direct oversight over instead of handing that out. So again, a physician has X amount of time in a day. They're going to want to still leverage their staff to scale out the efforts, but there's always going to be a handful of patients that they may directly want to oversee throughout the month. Yeah, so that's one opportunity. And the next one is there's an increased reimbursement opportunity for RHCs and FQHCs. The standard GO 511 code that is used that I mentioned that has reimbursed at $62 per patient per month to date. They're upping that to $65 per patient per month. So at that price point, it's a nice, very nice incentive that we expect all RHCs and FQHCs should definitely take part in.
And then talk a little bit about how practices, and we talked increasing revenue outside of the fee by billing for behavioral health codes. How can practices increase their revenue?
CCM, again, is an extension. It is a lever that one pulls in order to supplement their pop health strategy. There are other programs out there. You start to talk about the one that's been around for a while, TCM, Transitional Care Management. BHI is a little bit more recent, Behavioral Health Integration, where you're really caring for the behavioral and mental health side of patients. Separate and reimbursable separately. They can both be billed in the same month. So these are fee-for-service opportunities that can definitely be supplemented to help increase revenue. And the other one out there that really complements CCM probably the best is really an AWV, or annual wellness visit strategy. I'll say a high value AWV strategy, and that's you're already identifying patients for CCM. And ideally identifying your highest risk, highest value patients Well, when you combo that in with a strategy to identify and get in your highest value patients for annual wellness visits that may overlap with CCM, it's a very complementary program that you're getting your base touch points with your AWVs, and then when you are not seeing them on that annual basis, those out of office touches throughout the year for CCM really complements the revenue side of the business as well as the proactive care side.
And when we talk about out of office touches, what are we referring to in that case?
There are a lot of different methods, especially as technology advances. So one of the up and coming technologies that you're starting to see more and more are your telehealth visits with really virtual visits, I'll say. But really telehealth communication can encompass anything that has to do with communication that is outside your practice. So if you're leveraging text messaging, secure messaging, staying within HIPAA compliance, you can leverage phone calls, emails, however you are engaging those patient populations, basically when you're not face-to-face with them is what we're talking about.
And what advice would you have for practices who may be considering some type of chronic care management program, or, as people, as providers are looking to expand services? It seems like behavioral health is always one they always expand into. What advice would you have for practices if they're looking to get into CCM?
Mm-hmm. So for CCM especially, and even as you assess any program, we always have the same approach. And the number one thing you have to do is first understand your population. There's a lot of practices out there may just by feel and being around the office for a year, you definitely will get a feel for your most prevalent conditions that you treat at your practice, or the most prevalent demographic or age range or that you serve at your practice. But really the number one thing is just understanding your population. And after you understand your population, just find a way to get started. Once you understand your total population, you're going to want to assess your active Medicare population. CCM is branching out, especially into the private payer segment, beyond just your standard Medicare age patients and Medicare program patients. But regardless, the best place to start is assess your Medicare patient population, which is most prevalent for this program. The next thing you're going to want to do is assess your own care management team and whether they have the capacity to proactively go after chronic care management patients right now. And if not, what does it look like? How do you understand and put together a return on investment to get a care management team stood up so that you can go after them? The next thing that you're going to want to do is leverage your existing analytics to identify your highest risk, highest value patients. Again, we talked about an AWV CCM strategy in conjunction, but especially when you're talking about CCM, analytics can be very powerful when you're not just going after the standard 2+ chronic conditions with Medicare as the payer. When you can start targeting patients that really are high value, that maybe they have hypertension and a BMI over 30, and then you can start addressing these patients through CCM, managing their chronic conditions while also tapping into these super high reimbursement opportunities. These types of patients, you could turn a $117 annual wellness visit into over a $260 annual wellness visit just by adding things like obesity counseling, depression screening, diabetic screening, advanced care planning. All of these things can come in conjunction and come into play with your CCM strategy if you're targeting the right patients. So go after the ones that you can identify high value patients. Go after them with your current resources, and those that you don't have the resources to go after, call us up here at Greenway and see how we can help you get the rest of them.
And that's a great way to wrap, because I was just going to discuss our website, and thank you for coming on. So Chris Gibson, product analyst of population health here at Greenway Health, thanks for making the time to be back on our podcast. We appreciated it.
Yeah, great to be here. Thank you.
And as Chris mentioned, for more information on care coordination services, you can visit our website at www.greenwayhealth.com. Click on Solutions, and under the Solutions tab, you will see Care Coordination Services, which discusses a lot of the topics that we discussed on this episode of putting possibility into practice and how you can get in touch with somebody here at Greenway Health to discuss your options as a provider for chronic care management. Once again, Chris Gibson, the Product Analyst of Population Health here at Greenway Health, my guest on this episode of Putting Possibility into Practice. And as I did in the intro, I invite you to subscribe to our podcast on your platform of choice, and we're on a number of the popular podcast platforms now, including Apple Podcasts, Google Play Podcasts, Stitcher, TuneIn Radio, Spotify, SoundCloud, Libsyn, and will be coming soon to many others. I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and this has been another episode of our podcast, Putting Possibility into Practice. Thanks for listening.